Greetings, Council members, delegates and colleagues. My report to you on the work of the Aquatic Animal Health Standards Commission takes a different form this year. And as you know, a major difference is that there's no opportunity for adoption of standards from the Aquatic Manual or Aquatic Code. However, it is an exciting period of time for the work of the Commission, and I'm delighted to be able to bring you this report on behalf of my colleagues. So in this presentation today, the presentation will be broken into three parts. I'll talk about the key activities of the Aquatic Animals Commission and progress over the last year, our forward work plan, and also I'll speak about something very exciting, the OIE Aquatic Animal Health Strategy. So in the first part of my talk, I'll talk about some of the work that the Commission has been doing. First, I should introduce my colleagues on the Commission. So there is Ed Peeler from the UK, Dr. Atle Lillehaug from Norway, Professor Hong Lu from China, Dr. Kevin Christensen from South Africa, and Alicia Gallardo from Chile, and of course myself from Australia. I should mention that the work of the Commission is something that has a lot of contributors. Importantly, the OIE Secretariat provides us with an amazing level of support and commitment. And on behalf of the Commission members, I'd like to acknowledge their fantastic contributions to our work. But also there's a range of experts that we draw on to complete our work. And those experts either formed in ad hoc groups or provide support in their role as reference centre experts. And also there's the many experts from within your countries who provide input through the commenting process on our draft reports. So of course there's some changes to the way the Commission is doing its business in 2020. One of the key issues that I've already mentioned is that there's no aquatic code or aquatic manual chapters that can be adopted in 2020. So all of those texts that were to be proposed for adoption in May 2020 have been circulated for member comments. So this is another opportunity to refine those draft texts. And they've been circulated in the Commission's February 2020 report. What we're seeking on those chapters or texts is substantial or substantive comments that have not been submitted previously. So this is an opportunity to provide further enhancement of these documents. The deadline for those comments is the 10th of July. 2020. So with those chapters that were to be proposed for adoption in May 2020, the Commission will look at any further comments that we receive in either our September meeting or our February meeting in 2021, and we'll make any further revisions. And in our February 2021 report, those chapters will again be included in our report and proposed for adoption at the general session next year. So since the general session in 2019, the Commission has had two meetings. The first of those was in September 2019, and the second was this year in February. Our meetings are 6 days long. There's also electronic work that we conduct between meetings, and of course, with the COVID-19 situation, there's an increased amount of work that we will be doing out of session. And in addition to our regular Commission meetings, Commission members also participate in all of the ad hoc group meetings that occur. So we have at least one Commission member attending those meetings. So some of the key issues that we've been working on for the Aquatic Code, one of them is a new chapter on biosecurity for aquaculture establishments. This is in section 4 of the Aquatic Code, disease prevention and control. So this is the second major new chapter that has been completed for our planned revision of section 4. So the draft chapter has been circulated 3 times for comments between September 2018 and September 2019. And in February, the Commission reviewed further comments on the chapter, and we made some additional changes. Most of the changes were editorial in nature, but there were a couple of significant changes. For example, one was referencing the need for cooperation when biosecurity measures are being implemented in shared water bodies. And another was the importance of briefing visitors to an aquaculture establishment to ensure compliance with the biosecurity plan. Another important piece of work has been on the proposed listing of an emerging disease, infection with decapod iridescent virus, otherwise known as DIV1. So the proposal to list DIV1 was provided in our February 2009 meeting report for the first time. It has been provided for comment by member countries 3 times now, and with each of those times the proposal has been provided, there's also been an assessment against the criteria for listing. So the Commission has considered comments on the assessment against listing and has concluded that it should be proposed for listing. So that proposal will go forward at the next opportunity in 2021. And a major body of work for the Commission has been considering the approaches to declaration of freedom in the Aquatic Code. So this includes the articles relevant to declaration of freedom in each of the disease-specific chapters, and also chapter 1.4 on surveillance. To initiate this work, the Commission wrote a very detailed discussion paper, and that has been provided for member country comments twice. And at our most recent meeting, we reviewed the comments on the paper. Many of the comments were, or most of the comments were very supportive, and we believe this discussion paper has now served its purpose, and we are now intending to proceed to the revisions that we need to make in the Aquatic Code. So those revisions include model articles for the disease-specific chapters, so they've been provided in our most recent report, and we are commencing revision of chapter 1.4 on surveillance. So that will be an important piece of work to support the proposed changed model articles that have been presented in our most recent report. There's been an ongoing body of work to apply criteria for susceptibility of host species to infection with OIE listed diseases. We're now commencing, or now well into completing those assessments for fish diseases. So recently completed assessments include infection with viral hemorrhagic septicemia virus and also spring viremia of carp virus. VHSV in particular is quite a complex assessment because there's a huge body of work and quite a broad host specificity of VHSV and several genotypes. So I'd like to acknowledge the wonderful work that has been completed by the ad hoc group, not just on that disease, but on other diseases. The next assessments that we've asked the ad hoc group to complete are on infection with red sebum iridovirus and also infection with Aphanomyces invadens, which is the causative agent of EUS. And now that we're coming to the end of the assessments on fish diseases, we've formed an ad hoc group to look at the susceptibility of mollusk species to infection with OIE listed diseases. And that ad hoc group has commenced its work, and it's commenced its work with assessments of Bonamia excidiosa and Bonamia austriae. There's also a very significant body of work that we're progressing to revise the aquatic manual. You would have heard me talk about this in previous presentations. What we're trying to do with the revision of the manual chapters is to improve the quality of and usability of each of the disease-specific manual chapters. We're doing that by applying a new, more user-friendly template that provides improved guidance to users on, including on some specific areas, so the level of validation of assays and clearer recommendations on appropriate purposes of use of different assays. The first chapters to be revised into this new template, and with the revision into the new template is a complete update of the scientific information in the chapters. The first ones to have been completed include infection with infectious hematopoietic necrosis virus, infection with spring viremia of carp virus, infection with viral hemorrhagic septicemia virus, and also a new chapter for Batrachotrophium salamandrivorum, so that's a pathogen of salamanders. So these are the first 4 new chapters to be completed in the new template. They were to be proposed for adoption in 2020, and we now have an opportunity for some additional comments on those chapters, as I mentioned, by the 10th of July. We've also completed the first revisions of 2 fish disease chapters, infection with Gyrodactylus salaris and infection with Salmonid alpha virus. They are also available for comment in our report from the February meeting. At our most recent meeting, the Aquatic Animals Commission reviewed the annual report of reference laboratories and collaborating centres. We do this very thoroughly to check the activity of the reference centres. And I'd like to acknowledge the very strong contribution that the reference centres are making to the OIE community and to support the OIE mission. The Commission also reviewed 5-year work plans from collaborating centres. So this is a new initiative where collaborating centres are asked to present work plans over a 5-year period. And the Commission was very impressed by the range of activities of the collaborating centres and their relevance to OIE member countries and also to the OIE Aquatic Animal Health Strategy, which I'll speak about in a few moments. We also considered some applications for OIE reference laboratory status. So these were for 4 diseases: acute hepatopancreatic necrosis disease. This is a disease of shrimp. infection with white spot syndrome virus, also a disease of crustaceans, IHHNV, and Hepatic Bacter pneumoniae. So we've recommended acceptance of those applications for reference laboratory status. There's also a proposed change of expert at the OIE reference laboratory for infection with koi herpes virus in Japan, and the Commission has also recommended approval of that change of expert. So now I'll just talk about our forward work program. And of course, the forward work program is influenced by the impacts of the COVID-19 pandemic. So we have looked at the work that we can achieve, and what we've found is that there's only really some minor adjustments that have been required, and much of our work can continue to occur remotely. So for example, some of our ad hoc groups who would normally meet physically, completing some of their work virtually and also out of session. What the change in our work program has meant is that there's an opportunity to refine some of the chapters, as I mentioned, that were to be proposed for adoption in 2020. So that's an opportunity that I think that we can use well. But in saying that, those chapters would have been proposed for adoption in May 2020. So we really do want to spend most of our time progressing other texts that are in an earlier and less advanced state of development. So that will be the focus of our September meeting. The planning for our September meeting is well underway. There's some challenges, of course, meeting virtually across many time zones, but we've given some very careful consideration to how we can conduct that meeting effectively and efficiently. And we think we will be able to achieve a very similar work output to what we would normally when we meet physically in Paris. Some of the key items ahead for us. I mentioned section 4 of the Aquatic Code, disease prevention and control. So we've now had 2 new chapters. The first was disinfection, and the second that will be proposed for adoption next year is on biosecurity in aquaculture establishments. We have 2 more chapters that we're beginning to develop. These are draft new chapters on emergency disease preparedness and also on disease outbreak management. So very important chapters to support some of the provisions that are included elsewhere in the Aquatic Code. As I mentioned, we also have further work to do to conduct the assessments of susceptibility of species to OIE listed diseases. So I mentioned mollusks, but there's also some work to do on amphibian diseases as well. I mentioned the work on Declaration of Freedom. One of the next significant steps is to revise Chapter 1.4 on aquatic animal surveillance. This chapter hasn't been revised for quite some time, and there really does need to be substantial revisions to the chapter so that it can support the approaches that the Commission has presented and that member countries have commented on in the discussion paper that we produced. We recognise that there has been a rapid development of environmental DNA methods for surveillance, and including for aquatic animal pathogens. And some of those methods are in use in member countries. The Commission has agreed that we should consider the benefits and drawbacks of using eDNA methods and their limitations, of course, for surveillance. and we aim to develop a discussion paper for information of member countries, and also to discuss how eDNA methods might be incorporated appropriately within the aquatic manual chapters for specific diseases. And of course, I'm very excited about the new OIE strategy on aquatic animal health. I'll talk about that in a moment, but the Commission has been involved in the development of this strategy, and one of our activities will be to support the launch of it and also the implementation of the strategy when it does commence. Okay, so developing the OIE aquatic animal strategy, animal health strategy. Those of you who were at the OIE Global Conference on Aquatic Animal Health in Santiago in April last year may recall that the OIE Director General committed to developing an OIE strategy for aquatic animal health. So the work to develop the strategy has commenced soon after the conference, and the Commission has been working on this at its September 2019 meeting and also at our February 2020 meeting. So the strategy has been developed based on many inputs, including recommendations from the global conference in Chile. So it incorporates some of those recommendations in the activities. There's also been consultation at OIE regional commission meetings where timing has allowed, so where those meetings have been held during the latter parts of 2019. And in December of 2019 and January of 2020, the Commission, together with OIE headquarters, developed a survey of member countries and experts to explore their views on key issues and objectives that may be addressed in the aquatic strategy. And that was a key activity that informed and confirmed the approach in the draft strategy. And as I mentioned, the Commission's played a key role in supporting the development of this strategy. So it's been a key component of our work plan. So what will the strategy do? Well, the high-level vision of it is to improve aquatic animal health and welfare worldwide. And that vision will be pursued through 4 objectives. Those objectives are on standards, capacity building, resilience, and leadership. And within each of those objectives, there's specific activities that have been proposed that will make progress towards achieving the 4 objectives and ultimately the vision of improving aquatic animal health and welfare worldwide. So this is a strategy that's not just for the OIE headquarters, but it's for the OIE community. And when I say the OIE community, I mean member countries, including their private sectors, OIE reference centres, partners of the OIE, and also OIE staff. Progress towards developing the strategy is quite advanced. It is now in the final stages of editing and design. The strategy was to be launched at the 2020 General Session, but will now be launched virtually in the coming months. So please look out for further information on the OIE website. In my view, this is a very exciting initiative of the OIE, and I think it can really drive substantial change in how globally the OIE community and its partners can collaborate to pursue that vision of improving aquatic animal health and welfare worldwide. And on that note, I'd like to thank you for your attention, and I look forward to seeing you hopefully next year at the 2021 OIE General Session in Paris. Thank you very much.